ArchWell Health is hosting its 4th annual Pink Letter Project, and I'm speaking with Dr. Linda Johnson all about how vital it is to have mammogram screenings. So, Dr. Johnson, for people who might be unfamiliar with the work that ArchWell Health is doing, can you share with us a little bit about what it is that you guys do?
ArchWell Health is a national company that takes care of folks over 60 years of age in a very personalized primary care fashion. We take Medicare Advantage only, and we're a contrast to the traditional fee-for-service where unfortunately, the way they have to make their money is in volume. So they see member after member after member. We don't make our money that way. So we're able to slow down, take time, really get to know our members. They really get to know us. And so we can really have a deep, meaningful impact on making sure that they're living their healthiest, best lives in a time of life that they deserve that. So,
speaking of that impact, there is the Pink Letter Project that you guys do in terms of an initiative. And then there's also a Pink Letter Project Day. Can you share with me a little bit about how that works?
So this is going to be our 4th year of doing this at ArchWell Health nationwide. So the Pink Letter Project Day is July 15th, and it kicks off a 3-month celebration of helping women get their mammogram screening early. So everybody's used to the traditional October's National Breast Cancer Awareness Month. But what happens is with all of that focus, then it kind of creates a clog in the system. Women are trying to call in, get their mammograms. The imaging centers are booked up. It might be hard to get their visit. And then what happens is they don't get it done. And that's the last thing we want. We want women to get their screening done. So we've done this, as I said, for 4 years in a row now. And so we're pushing them to get it done before it gets so busy in October. So get it done now.
Yeah. You know, we often hear about that awareness come the month of October, and I think it's great that you are pushing that ahead of time. So can you elaborate a little bit more about why that is so critical to even have the mammogram done as well?
So breast cancer in our country increases with age. And the population that we're talking about, 60 and above, is approximately about 60 million women in our country. And about a third of those women, between 20 to 30 million, have not gotten their breast cancer screening, or they're behind in getting it done. And it's so important to do breast cancer screening because with that, we detect it early while it's still treatable and we can do something about it.
That's right. For what you guys do here at ArchWell, what is that significant difference from what people are normally used to with their regular healthcare providers?
So what's different here is just the fact that we're able to spend more time with our members. So instead of being a rushed 5-10 minute appointment, it can be 40 minutes, an hour, whatever they need. We have same day availability, so they can come and see us whenever they need to, whatever the issue is. We try to do as much as we can within our walls. So we do the blood draw here, we do lots of the testing here to make it easier for them. We provide transportation. We're sitting in our activity room, which is where we do a lot of educational activities, social activities, and just informational activities. And those latter things, all those activities, they're important for our members, but the community can come in and partake of those as well. And so as we kick off July 15th, we'll have lots of breast cancer awareness activity within the activity rooms, and the public is welcome to come and learn about that too.
Yeah, well, for folks who are watching saying, I want to get connected with you all, where can they go?
So if they want to become an ArchWell Health member, they can just walk into any of our 8 centers here in Las Vegas. You can also go online to archwellhealth.com. And you can also find information about the activities that we have in the Activity Center and the educational opportunities on that archwellhealth.com, or we've got calendars on the counter if you walk into a center.
Yeah, well, Dr. Johnson, thank you for having us today.
Thank you.